Hey, good day and good evening, everyone. I hope you have had a great day so far, and it will be continued like that. So please let me know if you can all hear me and if everything is working fine. I will appreciate this information from you. So I will be also sure that we can start without any troubles. I'm Sophie, and I will be your host today, and welcome everybody to IVF Webinars by Egg Donation Friends. We meet here every week to talk important matters, and we are doing this for you with help of our partners, Eiselspende Fertility Clinics Abroad and Donor Conception Network. And we are here today together with Dimitris Kavakas from Redia IVF Travel, the expert in fertility travel sector, and there's no surprise that we will be talking about IVF Refund Guarantee or money back programs in Europe, pros, cons, costs, risk at a glance. What should you know before you decide? The presentation on the topic will take around 25 minutes, and after that we will start with the Q&A session. So if you have any questions, you can type those questions in the chat section starting even from now. And one more thing, this IVF webinars is being recorded, so the rewatch will be available on our website tomorrow. And I think that's all from me for now. So Dimitris, if you are ready, we can start.
Thank you, Sophie. I'm ready.
Yes, fingers crossed, and let's do this.
Okay, thanks everybody for being here, for participation in this webinar. I'm here to give you some thoughts and ideas and some knowledge about what are the refund guarantee programs, why or why not choose to go for a program like that, or how to decide. First of all, let me talk about the success in IVF treatment. You know, IVF, unlike some other medical treatments, has still a significant percentage of failure. So there is no guarantee that you will get into a treatment and you will succeed. Despite all the medical advances, the high technology that we have today, there's still nobody can say that we can reach high levels of success, 90 or 95 or 100%. So the financially speaking, IVF is an unpredictable process because you get into a cycle, you spend a lot of money, and you have a chance to succeed, a chance to fail. So you have to pay again and again and again. I've met in my long years of experience in the IVF sector, I've met patients who have been trying for several cycles and been financially devastated. So everybody talks about success rates, you see. All the fertility patients I often talk or they go to any clinic, they ask, what's your success rate? So this, to be honest, is not the right question to ask because success rates can mean many different things. First of all, pregnancy rate is a different thing. So you have a pregnancy test, and that is positive, and you consider that this is a success. But then you have to listen to a heartbeat. That's another rate. Or 12 weeks of pregnancy is called, after the 3 months, is called the established pregnancy, another rate, or live birth rate. So there are lots of different rates. So what happens is clinics easily manipulate success rates, not always in a bad sense, but from choosing to say that the success rate is X or Y, and not referring to what is the success rate. can be misleading, because a positive pregnancy rate to live birth that is from 5 to 25 miscarriage rates. Average is 15. So in addition to that, age grouping can be also manipulated to make up success rates and present a high success rate. Of course, there are clinics also who just put a fake success rate because nobody checked them. So sometimes in some countries like the UK or Spain, for example, there is a state agency that controls and checks fertility clinics. So the success rates they publish should be the real ones. But there are other countries in other areas that there's no checks. So clinics can just say whatever they want without anybody checking on them. So you have to bear in mind when you look at success rates, what are those success rates, and how do the clinic produce those success rates? So what are the factors that affect success? First of all is the quality of genetic material. So depending on the egg, the quality of the eggs and the quality of sperm, there are factors that affect success. The age, mostly the female partner's age, but nowadays there are research that demonstrate that even the age of the male factor is important. In the past, the age of the male partner was not given any importance, because they say, oh, men can produce sperm at any age. But now research have shown that this is also an important factor, that the DNA quality of the sperm also diminishes by age. The quality of the lab and scientific expertise is very important. In IVF, almost 70% of success is the quality of the lab, and only 30% is the quality of the doctor and the protocol that he applies. So many times fertility patients do a mistake, that they focus too much on the doctor, and they go to a doctor because he has a reputation, has a famous name, but they concentrate on the doctor and they oversee the importance of what kind of lab, and what is the technology, the lab that the clinic that this doctor works for has. So of course, the doctor's medical expertise and the protocol he applies it also affects success. And I'll come to the point that we talk about different protocols, and there are clinics that they have so much patients that it's like a factory, an industry, that they apply specific protocols to everybody without personal attention to the specific person and what his needs actually are. So you should be looking for clinics that will look and focus on your specific problems and design a tailor-made protocol that will suit your needs, not everybody's needs. And finally, success is an accumulative process. So you need to understand that you may not, or you're likely not to succeed in the first attempt. So you need a few transfers or a couple of cycles or 3 cycles to achieve your success. So that comes to my point, and talk about what is a refund guarantee program. I think most of you are here to learn and listen about that. So basically, a refund guarantee program is your ability to do a multi-cycle program at a set cost. So you need to know how much it will cost you. So it will take out the uncertainty of financial insecurity from you. So you know that I'm going to pay 10,000, 15,000, 20,000 pounds or whatever It's set fixed cost, but I will have to do as many cycles and many transfers as the program gives you. And at the end of the day, if it doesn't work, I will get all my money back. So you know how much it will cost you from the beginning, so you can calculate your budget, if you can afford it or not. You can get a loan or whatever, but it's not unpredictable anymore like IVF is. And you know that if it doesn't work for me, I will get all my money back, so I don't lose anything. So if I take a loan and it doesn't work for me, I will repay the loan. I get my money back. So what is the concept of the refund guarantee program? First of all, as I said before, it controls the costs. So you know how much it will cost. I'm listing here the concept, and then I go deeper into each one of those and talk about control costs, ensures affordability. It guarantees the quality of the treatment. I will explain in a moment how it does that. It achieves personalized attention, and it's basically what the guarantee program is. It's an insurance. Like you insure your life. You get a life insurance, or you get a medical insurance, you get a house insurance, but you don't expect to have an accident. You don't expect somebody to break into your home. You don't want this to happen, but you still pay for the insurance. So this is the refund guarantee program. You pay an insurance in case you fail, but you don't want to fail. You want to succeed first time. So this is the concept. First of all, it controls the cost. You know how much you have to pay from the beginning until the end. You can pay by installments. You can organize your payments. Some refund guarantee programs have installment options, and also there is a financing option. Some refund guarantee programs collaborate with banks or financial institutions that will offer you loan options. For example, if it costs £15,000, you get a loan for £15,000, and you can repay the loan in 48 months, paying I don't know, £100 a month or whatever, with an interest, of course. This option has an interest. Okay. The program ensures affordability. So affordability means that you know how much it will cost you. You have different options of clinics at different prices, so you can choose, of course, on your preference of clinic and country location, if you want to travel abroad, or if you want to stay in the UK or your country. I don't know if most of you are from the UK or you are watching from different countries, but you have the option of staying at home if there is a clinic who offers such program in your home country, or you travel abroad, but you have the choice to choose a clinic that suits better your budget. And there are no surprises. So you need to check what is included. Of course, saying that, not all refund guarantee programs are the same. So you need to make sure they're not surprises, because some refund guarantee program may say in small letters that this is not included or that is not included. So you need to know exactly what is included and in what you're paying for. Guarantee the quality of treatment. This is an important element of those programs. So you do not need to worry about quality because others do the screening for the quality for you. A refund guarantee program means that the company who offers the insurance of the refund, gets all the risk of the refund. So it's in the vested interest of that company to secure that the clinic that offers you the treatment is the best one, and it produces actual results. Because if it doesn't, the guarantor, the company, loses money. So in a sense, you are in much safer hands by choosing a refund guarantee program, because others do the screening, others do the checking, and you just get the insurance and go for it in the best quality that you can have. Okay. So a refund guarantee program also achieves personalized attention, because of the guarantee, special attention is needed to achieve success. Sometimes several big clinics with a huge number of patients, as I said before, they don't pay attention to the specific needs of each couple or individual. That is a significant reason for failure sometimes. So high quality clinics always offer personalized attention. You get to speak to the doctor. If a clinic is abroad, you get a Skype or phone consultation with the doctor. So the doctor looks at your case. There's a whole team of people that looks at your case, study your case, and they offer you a personalized protocol. When you come to the clinic, you're taken care of. Anything that you need. Also the side things, because the stress of the treatment is enough, so you don't need to overload yourself with stress. Stressless treatment is important, and psychology is important as a factor that affects success in IVF. So most of the times it is small details that makes the difference, and you can see that such small details may be the borderline between success and failure in IVF. And finally, success or money back. Understand that you are paying for an insurance, as I said before, just like any other insurance, is a way to ensure yourself that you can either have what you want, because you get into an IVF, not because you like to have a treatment, like any other medical treatment, but the treatment is a tool that will get you what you want, and you want a baby. So you insured. Nobody can ensure that you will have a baby, of course, because everybody is human being. So only God can do that. So you pay for an insured IVF, but you want the baby as soon as possible. So the refund guarantees and guarantees that you either have the baby or you get your money back. Okay, so there should be no misunderstanding that these programs can actually guarantee that you will have a baby. No, they don't guarantee a baby. They guarantee that you either have a success or you get your money back. So now, what are the cons of a money back program? I list them in two categories. First of all, is the eligibility criteria. So like any insurance, you cannot just get it. You need to be checked. You need to be screened whether you are eligible or not, because the company that offers a refund guarantee program is not an NGO, a humanistic society. So it's not there to lose money, obviously. So it needs to check that the success possibility or the risk of the refund is not exceptionally high. And secondly, the chances to succeed in the first cycle, if it succeeds in the first cycle, you have paid much more than a single cycle. So obviously you have what you wanted, that is a baby, but you have paid much more for this. So these are the two main categories. So the first one, as I said, is eligibility criteria. So not everyone can be eligible. As I said, insurance companies will check certain details to minimize risk. For example, it depends on the program. For example, if it's a on-egg IVF treatment, they will look at the female partner's ovarian reserve, ask for hormonal tests, ask for follicle count scan, look at karyotypes, look at the endometrium, if it's normal or if it has fibroids, etc. So you want to make sure that there's no serious issue that will minimize success rates. And also, they will look at the male factor. They will look at semen analysis and a karyotype of the male partner to make sure that there is no serious risk in the sperm. So obviously, there is an age factor as well. So there are age limitations. Usually, is below 40 years of age, and some of the times it's up to 37 for a full money-back guarantee. Now, if we're talking about egg donation, the only case of concern in eligibility criteria is the quality of the endometrium. So for the receptivity. So the only thing asked is a transvaginal ultrasound scan, but the male factor remains as it is. So we need to check that the sperm is of a normal, good quality, and there is no age limitation in egg donation, obviously, because what affects the quality of the embryos is the age of the donor. Obviously, different countries have legal age limitations. In most European countries, this is the age of 50. So you cannot do any treatment if you're 50 or over. Some Eastern European countries have higher age limitation, up to 55. So you can still have some options if you are between 50 and 55. Over 55, there's almost no option, basically, for treatment. And the second category of the cons is the quick success. So what if success comes in the first cycle? Well, as I said, you get into an insurance. So this is part of your chances that you may succeed in the first cycle, and you don't get anything back. But you have what you wanted. You have a baby. So, however, I have to stress that in most proper refund guarantee programs, what is guaranteed is live birth. If it's not live birth, if it's, for example, positive pregnancy test or heartbeat, then I would personally have a second thought about that program, because the case of miscarriage is quite high. As I said, it's almost 25% miscarriage rate for after the positive pregnancy test to live birth. I think I have some numbers before, but afterwards, but I will talk again about that. So things to look for in a refund program. As I said in the beginning, what is included? Very important to know what is included in the program. Second, what is the refund percentage? Is it 50? Is it 70? Is it 80? Is it 100%? What is the percentage? What is guaranteed? Is it positive pregnancy test or is it live birth? And also travel cost. You have to do your calculations, because a clinic that is an hour flight from your house may cost much less than a clinic that is 5 or 6 hours flight, and generally speaking. So you need to calculate all your costs before you make any decision to see what actually is according to your budget. So what is included? Medication is an important element that some refund guarantee programs do not have it included. These can be really high. So you may compare a refund guarantee program, for example, of £12,000 with a refund guarantee program of £14,000, the £14,000 may include medication and the 12 may not include medication. Actually, if you do the calculation, the 14 is cheaper than the 12 because the cost of medication for a 3-cycle program, including frozen transfers, can be more than £4,000, just the medication. Are lab methods such as ICSI or blastocyst culture included or not? Are frozen transfers included, or you have to pay extra? So these are the things you need to ask and put in consideration while considering and while comparing different programs. What is the refund percentage? Is the refund 100% or is less? Some they offer 80%, some 70, some 50 or whatever. So you need to know what is the refund and is the total amount guaranteed or is a percentage? For example, sometimes you have some extras that are excluded. Say this is the program includes medication, but the medication may not be refundable. So you need to know exactly what is refundable, what is the amount that will be refundable in case of failure. And what is guaranteed? This is the point that I have the miscarriage rate percentage I told you before. Positive pregnancy tests, some programs guarantee positive pregnancy tests, but there's a 20% average miscarriage rate. What happens if you pay £15,000 and you get a positive pregnancy test first transfer and then you miscarriage? You lose all your money. Yeah, so you need to know about that. Heartbeats, positive, the heartbeat, there's a 15% miscarriage rate. 12, some programs offer 12 weeks gestation. There's still a smaller, much smaller, but there's still a 5% miscarriage rate. Yeah, or it's a live birth. If it is a live birth, then you guarantee that you either have a baby or you get your money back. So these are things you need to consider. And finally, you need to calculate travel costs. Yeah, how much do you need for flights? How much do you need for hotels? How much you need? So you make your calculations and then see which one. If you need to compare 2 or 3 countries, 2 or 3 clinics, and have the prices. If, for example, cost is of concern, because you may choose a clinic that is more expensive because of quality, and or other reasons, for social reasons. If you like a country, you like to go there, that's okay. But you need to know in order to calculate how much it will cost you, because travel costs are not included in any refund guarantee programs. You need to know a faraway clinic may appear cheaper, but if you add the travel cost, maybe not that cheaper as you thought in the beginning. Okay, so I think that was all. I did my 25 minutes, and so I would like to open the floor for questions.
Yes, exactly, Dimitris.
Yes.
Thank you. Thank you very much for the presentation and all the information you gave us so far. Now we will be having the Q&A session. So please, everybody, type your question in the chat section so I can display your question and ask Dimitris. We need to wait as somebody is typing. I think that more than one person is typing, and I will be displaying questions on the screen and read it out loud so we can start. Yes. How can I recognize a clinic that offers personalized service?
Well, if you go for a refund guarantee program, then the company that offers you the program has to guarantee that. So you know that the clinics they recommend are already screened, because it's in the vested interest of the company. I have such a company, so I don't want to promote my company, but as I said, what we're doing, it's in our vested interest to make sure that the clinics we work are the best and they produce results, not just marketing, but actual results. So part of the success of the results they produce is personalized service. If you go for a single cycle to any clinic, or if you talk, you understand if it's a personalized service by the way you are treated by the personnel. So there is clinics who offer personalized service. They have coordinators who immediately are in communication with you. They answer your questions. They provide you support. They arrange Skype with a doctor to do a consultation. They organize your trip. They meet you. They take you everywhere what you need to do. So that they're taking care of you. That's what it means, personal service. The clinics that do not offer personal service, you go there and you wait in a queue in a sitting area of 20 or 30 people to be called. That's not a personalized service. Yeah. So you will understand, but maybe you will understand that too late. So you will be committed into a treatment.
Thank you very much for the answer, Dimitris. And we will then take a look for the next question. Which clinics, for example, offer 100% money-back guarantee in an egg donation program and are also high-quality clinics? Do you know such ones? Can you give an advice? Very interesting webinar.
I cannot name clinics live. Obviously, we have, and that's why we work. And I guess all the companies who work like we work and offer refund guarantee programs, that's what they're looking for. They're looking for clinics who offer very good quality so as to guarantee that they're not going to lose money by giving back refunds all the time. And the money back guarantee is not given by the clinic, it's given by us, by the company, by the insurance company, IVF Insurance, who does that. It's to the clinics that we decide to work with because we have screened the clinics and we believe that they produce good results, they produce a good quality, and we decide to work with them. So these are the clinics that we offer the 100% refund guarantee programs. I'm happy to talk in person and exchange emails to anyone who's interested to find more details about such clinics.
Thank you, Dimitris, very much for the explanation. And yeah, it may happen that we will have many specific questions, but if you have such questions, everything that we have from today's webinar, we will forward to Dimitris directly and to IVF Travel. So if you have any specific questions like similar one, you can always throw us an email to the address which I just paste into the chat section. And if you do that, we will forward all the information from you to Dimitris anyway. And maybe this will be also the way, to contact you both. So yeah, we are here to link good experts with you. So we are more than glad to do that. Then we will take the next question. And yes, there will be also clinic related, but the first part, maybe you can add anything on that. What is the cost of program with live birth guarantee? Any clinic that you can suggest? We know that.
I answer the clinic. As I said, I cannot just name a clinic here, but the cost depends on the clinic and the country. For example, I can give you a rough idea of the programs we work for because.
Yes, exactly. And just to interrupt you, without naming clinics, we have the similar.
Because what we are doing, we have an all-inclusive program. That is, we want to make sure that there are no surprises. So we include medication, we include lab methods, ICSI, blastocysts, frozen transfers, freezing costs. We include everything into 3-cycle programs. with 100% refund guarantee. So, I'm telling this to give you the price ranges, but also to be able to compare. I cannot talk about other programs of other companies. So it depends on the country. For example, Spain, you will find that it's in the region of 16 to 18,000 pounds. I'm talking in pounds now, but you can make the conversion in other currencies. In Greece is a destination that is popular for IVF and egg donation. It's slightly cheaper. You will be looking at 13 to 15,000. Similar prices in Czech Republic. As I said, it varies between clinic because the price of the program is it's like any insurance. It's an algorithm. It develops on the prices of the treatment itself and the success rate of the clinic. So it may be the case that a clinic is more expensive, but because it has a very high success rate, it may actually be cheaper from a clinic that is cheaper, but it has a low success rate. So sometimes people ask me because there are countries that appear to be cheaper, but the programs are not cheaper, and I have to explain that this is because the success rates of those clinics are low. That is why the program tends to be more expensive. There are also countries in Eastern Europe, such as Georgia and Ukraine, that are between 11 and 13,000 pounds. So these are, and Turkey also is in that range of price. So you need to expect, obviously, egg donation is a different price, and own egg IVF is a different price. But you need to expect at least 10,000 pounds for the cheaper program. That can go up to 18,000 for the most expensive clinic, I would say.
Thank you for your detailed explanation. And then we have a question, which is, can you bring embryos to UK from Europe?
You mean, I guess, if they can, inpatient can bring. No, this is not something we do as a company, but embryos belongs to the couple, to the patient. This is not an issue of the insurance, of the refund guarantee company who offers the insurance. The patient through the insurance goes to a specific clinic, so they sign legal paperwork with the clinic that have ownership of the embryos that they produce. So it's their embryos. Whatever happened to the embryos, even if they become pregnant and they have a child first time and they still have embryos, it's their embryos. They can do whatever they want with them. They can pay the cost and transport them into the UK if they want. So this is not a problem. This is a matter of state legislation, but within the EU, and since the EU is still in UK is still in the EU, I don't know what will happen after Brexit. So nobody knows. But at the moment, yes, you can bring the embryos. The only issue would be egg donation, because the UK legislation requires the donor to be known, while most of the countries in Europe have anonymous egg donation. So there might be a problem in bringing embryos from egg donation into the UK from Europe.
Thank you for the question and your answer as well, Dimitris. And we will then jump to the next question. My wife had an IVF process which offered a guarantee of 2 embryos frozen besides that transfer. but only one embryo was frozen. Should I ask for a refund?
You have to see what you signed. Obviously, you signed the contract that explained exactly what you were getting. If the company has not fulfilled the contract, you can request. I don't. The program offered a guarantee of 2 embryos frozen. So was it a refund guarantee program or not? I don't. The question is quite ambitious. Sometimes clinics go into an IVF process and they say, "Oh, we guarantee minimum embryos," or it was an embryo donation of frozen embryos. So I need some clarification on the question to be able to say more about that. But yes, if they did not do what they promised, if the clinic did not do what they promised, at least you should ask for something. I don't know if it's a refund, or at least you should ask for explanations.
Yes, and for now we don't have any additional comment to this question. If it appears, then I will come back to this question. For now, we don't have any follow-ups. Yes. Okay. Yes, and the next question will be the discussion. Maybe you can help us a little with that. In order to bring embryos, I would advise to search for a proven courier service. But can you give us example of proven courier service? But maybe this will be not the question.
So I cannot mention any company names here. I'm sorry.
But they exist.
There are good. They exist. There are good, proven courier service everywhere. It's easily to find. But obviously I cannot, and I don't want to name any company names live here.
Of course, and confirmation, I think this is good enough for now. The next question will be, I've been looking at a program that guarantee is to 12 weeks pregnancy. Do you have any suggestions to support pregnancy after that and avoid miscarriage?
If a guarantee is 12 weeks, is not perfect, is not live birth, but at least the biggest risk of miscarriage is the first 2 weeks, 12 weeks. So after 12 weeks, as I said before, the miscarriage rate is 5% or less, but still exists. To avoid miscarriage, you should avoid, like for example, some of the terms we have in our refund guarantee program for to avoid miscarriages. We ask in the contract the patients to avoid extreme sports. And mentioning extreme sports is even biking. So it's risky. If you have an accident while biking or by doing any skiing, for example, you lose your baby. So you should avoid doing exercise that risk accidents. What else? You should have a good obstetrician, and you should have regular visit to the obstetrician at least once a month. But at the later stages after the 7 month, almost twice a month or even every week, to make sure that everything goes fine. The only thing I can say is this: just to have an obstetrician that you trust and is a good scientist and takes care of you to avoid miscarriage, and keep on taking the medication that the obstetrician recommends.
Thank you a lot for the answer. And then we will take the question, which is more rhetorical, but as you are a guy from the branch, maybe. Do you think that in Spain they will increase the age above 50 to enable the refund program in the future?
Spain is an interesting case. Actually, the law doesn't say anything about 50. they recommend 50, but do not prohibit. They leave it up to the clinic to decide whether the patient is fit enough to be pregnant after 50. That means that it's their own responsibility if something happens. So most of the times, that means that doctors and clinics in Spain will not do any treatment after 50 because they fear of the liability. If something happened to the lady in pregnancy, they are responsible for it. So nobody will do it. I don't know whether they will increase the age or not. There's nothing to suggest that they will do so.
Thank you for your answer. And now we will come back to moving embryos. Regarding bringing embryos to UK, where to contact for any legal process?
You search for a courier service, courier company that does genetic material transportation, and they will tell you. I don't know. I don't have the knowledge. We're not dealing with such issues, but the courier service who do them, they know the legal process and they will advise you what to do.
Okay, and thank you for your information about that. And then again about embryos. Can embryos from egg donation be transported from Spain to Poland, and who organized the transport? Yes, but can the Spanish clinic refuse to organize the transport?
The first part of the question, Poland. It should be. It's as I said, it's EU, so it should be allowed. I don't know if there is any restriction by the Polish government. Who organizes the transport is the patient who has to initiate the transport, not the clinic. The clinic has no right to refuse. It can refuse to organize, but the clinic is not the responsibility to organize. It's the patient who has to find the courier, and then the courier will do all the paperwork, and they will first talk to the recipient clinic in Poland or whatever country it is, and then they will request the embryos from the sending clinic. The sending clinic would just send the embryos when it's presented for the documentation.
And thank you for giving us insight on that. We can now move back to the question which we were waiting for the follow-up, which was this one. And this is the additional comment, just trying to clarify, it was an egg donation process.
Yeah, as I said, you need to talk to the clinic and to see what you've signed and talk to them. I don't know what else to say about that.
Okay, thank you a lot. And then we will take the next question. How many cycles does the program guarantee?
If the question has to do with how many cycles in the program, refund guarantee,
yeah,
it depends on the program. Our programs are 3-cycle programs because this is the average the cycles that an average person needs to get success.
How many times can you have IVF with the money back guarantee?
What do you mean? How many times? So you can do one program, and you can have 3 cycles, and in each cycle you have any transfers depending how many embryos you develop. Is that the question?
Yeah, or maybe if it will be unsuccessful, then if you can try another time, maybe this was an idea.
If it's unsuccessful and you get a refund, obviously you cannot do it again. But if it's success in the first cycle, yes, you can do another program for a second baby, if that's the question.
Okay, thank you a lot for your explanation. The next one will be, are there any other clinics which country who will offer treatment in age over 50 to 52?
As I mentioned, Eastern Europe, yeah. I know we personally work with Georgia, and I know Ukraine also offers that, and Russia, I think, um, offers the between 50 and 55. So these are the only ones I know.
Yes, and thank you for the question and the answer as well. We have one more question. Good evening. I have been looking at egg donation IVF and with the pregnancy guarantee programs. Does my cycle have to start and the donor match my cycle, or do I have my cycle match the donors? As I'm perimenopausal, so my cycles are very far apart. Is it likely I will be accepted going through perimenopause, or is it all due to my lining? Thank you.
Uh, this depends on the protocol. I don't think this is an issue at all. Yes, everything has to do with your lining. There's no problem to have a woman at menopause to induce a cycle and to get her pregnant. This is easy with egg donation. So the only thing is the lining. This is done by the doctor by using medication. You can fix your cycle. You can induce a cycle, and you can schedule a treatment. The best way to go around is by having the donor produce the embryos, fertilize them, and freeze them, and when you're ready for a transfer, they thaw the embryos and they transfer them. So that's the best, the most successful way of proceeding. Of course, you can do the matching of cycles, but it's risky because if something even a day wrong, you can lose the embryos and you can have a failed cycle because of that. The safest way that most of the clinics in Europe use now is called the freeze-all. So they freeze all the embryos, and when you are 100% ready and you have the best endometrium lining, they go for the transfer.
Thank you a lot, Dimitris, for this explanation. And this will be also a final call for question as we will be slowly finishing. But if you have any questions, please type them in. Thank you so much for your response about the freezing instead of matching cycles. Thank you so much. That's appreciated. That makes sense. Yes, it was actually a shout out, not a question.
Yeah. Okay.
And yes, thanks for all the information. Yes, I wonder if the technology to freeze eggs has improved significantly during the last decade. I did some attempts for 10 years ago, and the clinic said that frozen embryos would be much less reliable. Also, my treatment failed.
Yeah, the technology of vitrification changed everything in the IVF industry, and nowadays freezing of embryos, not eggs, freezing fertilized eggs, embryos, is actually proven to be more successful in a sense. Well, it has a 100% survival rate now, embryos, so it's same as fresh, but because when you freeze the embryos, you can then find the exact window of implantation in a frozen transfer cycle that can actually boost the success rate. So many, as I said, many quality clinics are chosen to go for frozen transfers only. So it's a choice, and it goes well. 10 years ago, it was a different picture. 10 years ago, the survival rate of thawing embryos was 25 to 30%. Now it's almost 100%.
My wife had 2 PGS embryos tested egg donation transfer cycles that failed. Should I do ERA test as she has endometriosis? But if it's too medical, as I told you, just please send us an email at patient@eggdonationfriends.com, and our team will help you with that for sure.
Yeah, this is too medical. I think a doctor should comment on the suitability of ERA test. It depends what PGS was that, which lab did the PGS. Was it day 3? Was it day 5? Was it NGS? Did they check all the chromosomes, or it was the old technology that checked a few chromosomes only? So without having complete information, you cannot really answer such questions.
Yes.
I'm happy to discuss with that person in person, to go through documentation and be more precise, because obviously without having data, you cannot comment and give advice.
Yes, totally. And that's why I also put the email address in the chat section. You can use it. We have a free online consultation program available for you also. So just feel free to use it. And we are here to help you. We have, I think, the last question. And this is also possibly the question which from the medical perspective is the question for the doctor, but maybe you want to add anything from your perspective. Is it not still higher success rate with fresh transfer than frozen? Although frozen is successful, fresh has higher percentage success. Is it right?
As I said, nowadays in most clinics, fresh and frozen success rate is almost the same. In some cases, the frozen is higher for the reasons I mentioned before. Not because the frozen is better, but because the window of implantation of the cycle can be more accurate in a frozen transfer cycle.
Yes, and thank you for the additional comment on that. And as we do not have any more questions, I think that we will be finishing. So there will be also a shout out for you. Thank you again.
Thank you.
All the attendees and for all the knowledge and information and support you gave us this evening. It was a great pleasure to have you here today, and I think it was really informative for everybody who was joining us today. So thank you.
Thank you so much.
Thank you.
Thank you.
Yes, and as I told you at the beginning, the webinar is recorded, so the rewatch will be available tomorrow on our website. You can always follow us on our social media, Facebook, Instagram, YouTube, and you will be always up to date. Thank you one more time, Dimitris. If you have any additional comments and you would like to add anything, you can do it now.
No. I think that was a great webinar. I'm happy. Great questions. If there was any question I haven't seen or I haven't answered, I'm happy to get the person's email and send the answers to them directly.
Yes, of course. And it was a great pleasure have you all here today. And it will be also really a great evening next week. So please join us. We will meet same place, same time to talk about endometrial receptivity and endometrial scratching and implantation window. And in 2 weeks also we have IVF webinars scheduled. So if you are interested, sign up, feel free to do that and join us. And for today, thank you very much, Dimitris. One more time, thank you everybody for your attendance and all your questions, and have a great evening, day or night, wherever you are. It will be a wrap. Thank you again.
Okay, thank you.